A very good morning to one and all. Today we are going to discuss about another upper respiratory infection, that is laryngitis. Let us see the definition. Inflammation and swelling of the mucous membrane lining the larynx or voice box, which is located in the upper part of the respiratory tract, caused by chemical or mechanical irritation or bacterial infection called as laryngitis. So what do you mean by laryngitis? It is a inflammation and swelling of the mucous membrane which lining the larynx or voice box. The other name for larynx is voice box. So it is an inflammation and swelling of the mucous membrane which lining the voice box. The larynx is lined with or covered with a mucous membrane. If there is any inflammation or swelling is occurring on the mucous membrane or the voice board, that we can call it as laryngitis, and it is mainly occurring due to any exposure to chemical or mechanical or bacterial infection. So these are the causes for laryngitis. Let us see the risk factors. Having a respiratory infection such as a cold, flu, bronchitis, sinusitis, or pneumonia, if any of the respiratory infection is there, then there is a chance of laryngitis. Exposure to irritants such as cigarette smoke, stomach acid reflux. Okay, so stomach acid reflux, that is a regurgitation of or a backflow of stomach content into the mouth, or a reflex which is coming, that content is coming to the mouth. So that time also, because of the acid present in the stomach content, the laryngeal mucosa will get inflamed. Exposure to irritants distributed by air conditioning systems such as mold, pollen, and pollutants, workplace chemicals, or dust. So due to the environmental exposure to irritants, okay, then extremely cold weather. So if the weather is too cold, then our climate is too cold, then excess alcohol consumption. So these are the possible risk factors for laryngitis. Let us see the causes or etiology. First one, voice abuse or misuse. Voice abuse means overuse or or if there is any kind of misusing, that we can call it as voice abuse. This means talking too much or too loudly. Okay, if you are talking too much, continuous talking, or if you are talking too loudly, so that time the vocal cord or the voice box will get irritated and inflammation can occur. Can be ongoing problem for people whose job depend on their voices, including singers, actors, telephone operators, lawyers, teachers, referees, coaches, and anyone who must shout over loud noise at work. So these are the people who all are more prone for or risk for laryngitis, and those who are in this particular occupation. Second one is smoking. Cigarette smoke irritates the larynx, cause swelling and inflammation that thickens the vocal cord. This thickening can lower the pitch of the voice or make it sound raspy and harsh. So, smoking can also irritate the laryngeal mucosa. Okay, it will irritate the larynx, and because of this one, swelling and inflammation can occur, and the vocal cord will get thickened. So once the vocal cord is getting thickened, then the proper sound will not be produced, or the sound which is producing having a pitch of voice make it sound raspy and harsh. A harsh sound or raspy sound will be there, not clear. Then viral infection, common cause of acute laryngitis. Then allergies, then larynx cancer, tumor. So these are the associated factor related to laryngitis. Then third one, gastroesophageal reflux disease, that is in short GERD. It is a disorder in which acidic fluids from the stomach flow backward into the esophagus and throat, irritating the larynx. So GERD means it is a disorder, gastroesophageal disorder, in which what is happening, the acid fluids from the stomach flow backward into the esophagus. It is coming backward or coming upside or out from the esophagus into the throat and larynx. So it can lead to irritation of the mucosa membrane because acid presence is there. Because acid reflux usually in worse when lying down, and hoarseness caused by GERD often is more noticeable in the morning right after awakening. So while lying down, this particular problem can occur, and due to this one, a hoarseness or a muffled sound you can hear. Then work related exposure to irritating chemicals or dust. So occupational exposure. So if you're working in a industry, means many industrial products are suspect of causing chronic laryngitis and other respiratory problems. So if you are working in a polluted environment or there so much chemical exposure is there, then there is a chance of laryngitis. Then alcohol consumption, that is also very important because alcohol can irritate the larynx. Like smoking, alcohol also can irritate the larynx, and that produce changes similar to the those seen in smoker. Like in smokers, what are the changes happening? Same in alcohol people also the changes can occur. Let us see the types. Mainly, it is of two type: acute laryngitis and chronic laryngitis. Let us see one by one. First is acute laryngitis. Definition: it is acute inflammation of larynx which lasts less than a few days and leads to edema of laryngeal mucosa and underlying structures. So acute means a short duration, sudden and short. Okay. So it is an inflammation of larynx which lasts less than a few days. Okay. Maximum 2 or 3 days it will be remaining, and which can lead to edema of laryngeal mucosa and underlying structure. So edema will be occurring on the laryngeal mucosa and underlying structure or adjacent structure also will be getting edema. Most cases of acute laryngitis are temporary and improve after the underlying cause get better. So once we are treating the underlying cause, for example, if it is cold weather or due to some flu or due to some viral infection, if you are treating, then it will normally it will cure. Then the causes are frequently caused by rhinovirus. Okay, rhinovirus is a causative factor for rhinitis. Then other causative organisms are parainfluenza virus, respiratory syncytial virus, adenovirus, measles and mumps, bacterial infections such as diphtheria. Okay, these are the common causative organisms which can lead to acute laryngitis. Then vocal misuse, if you are too much using the voice or if you are talking loudly. Exposure to noxious agent means poisonous or allergic agents. Then infectious agents leading to upper respiratory tract infection, any infectious agents like bacteria or virus. Inhaled irritants like chemical fumes, allergen or smoking, if you are exposed with smoke, allergens or any irritants or chemical fumes. Then acid reflux, that already we discussed. So these are the causes for acute laryngitis. Let us see chronic laryngitis. So definition is it is inflammation of the larynx that lasts more than 3 weeks is known as chronic laryngitis. Duration is more, okay, compared to acute. The duration is more. Acute is for few days. In chronic, you can see it is lasts more than 3 weeks. Chronic laryngitis is a more persistent disorder that produce lingering hoarseness and other voice changes. So here the characteristic is the sound change will be there. If when it is become chronic, that time the person will experience a hoarseness sound. Hoarseness means it is a loud rashy sound. It usually is painless and has no significant signs of infection. In the chronic state, the pain, the symptom in the sign pain will not be there that much, and there is no any sign of infection. Then the causes are vocal misuse, exposure to noxious, same like what we have seen in the acute. And along with this one, some more is there: chronic sinusitis, bronchitis, excessive alcohol use, habitual overuse of voice, then smoking. Then less common cause of chronic laryngitis are infections such as tuberculosis, syphilis, fungal infection, infection with certain parasites like some malaria or something, then cancer, then vocal cord paralysis. These are the common causes for chronic laryngitis. So I hope you understood about the causes. Just go through these slides. Next, we will discuss about the pathophysiology. What is the pathophysiology? How the cause that process is going on. So here you can see due to the etiological factors, this pathophysiology will be common for both chronic and acute. So due to etiological factors, the mucosa of the larynx become congested and may become edematous. So due to the etiological factors like any infection, any bacteria or any exposure to allergens, due to this one, there is an inflammation is occurring on the larynx and the mucosa of the larynx become congested and may become edematous. Okay. A fibrinous exudate may occur in the surface. So once the inflammation and swelling is happening, then there is some fibrinous exudate, some pus formation or some fluid collection will be occurring on the surface of the larynx. that will cause signs and symptoms. There the signs and symptoms will occur like hoarseness of sound, then difficulties for swallowing, this whole thing. Sometimes infection involves a perichondrium of laryngeal cartilage producing perichondritis. So sometimes it can extend to the perichondrial region of the laryngeal cartilage, which can lead to perichondritis. So this is a pathophysiology of laryngitis. Let us see the symptoms. What are the symptoms? The most common symptom is hoarseness. Okay, a loud rough sound, a low raspy voice loss will be there. Tickling sensation and rawness in throat. In the throat they can feel some tickling sensation, and rawness will be there. A voice that tries easily breaks or crack. Okay, when they are start to talking, that time there will be a break is occurring in the voice. The voice is sound is producing, and in between the sound is going, so like that. Then the sensation of a lump in the throat or a dry throat, sore throat. Okay, they can feel a sensation of lump or a something obstructed in the throat, or a some kind of dry throat or a soreness in the throat. Okay, so this laryngitis sometimes the acute laryngitis is occurring when you are exposing your sound to you are exposing your sound. Okay, so if you are singing, or if you are dancing if, in a loud voice, that time maybe in the next day you can also feel this kind of signs. Then difficulty in swallowing because of the obstruction. Cold or flu like symptoms like fever will be there, temperature will be there. Then swollen lymph nodes in the neck. Okay, neck lymph node also will get swollen. So these are the most common symptoms of laryngitis. And along with this one, a constant urge to clear the throat. The person is having a constant urge, like like that. Experience will be there. They are trying to clearing the throat. Then heavy mucus in the throat, chronic cough or postnatal nasal drip. Okay, nasal discharge will be there, chronic cough will be there, dysphagia, difficulty in swallowing, then coughing. So, and along with this one, difficulty in breathing will be there. This mainly it is experienced in children. Okay, and difficulty in breathing is encountering with children because of the narrowing of the larynx or the air passage. Then feeling of fullness in the throat or neck. See, these are the signs and symptoms of laryngitis. Let us see what are the diagnostic evaluation, or how we can diagnose the condition. See, including diagnosis based upon a combination of the complete history and physical examination. We have to take a complete, proper history of the patient about the condition. So, ask them whether they are exposed to any sound, or whether they are having a occupation related with loud sound, or whether they exposure to any environment irritants, or they are having any underlying diseases or respiratory infections. Then a symptom are severe, particularly in children, the doctor may order an X-ray of the neck and chest. If the symptom like a breathing difficulty or dysphagia, then soreness, then the doctor will advise them to take a neck X-ray. It will help to identify how much narrowing or obstruction is there in the air passage. Sometimes in children, rarely in adults, the doctor may order blood work such as complete blood count. So sometimes the doctor will advise for doing complete blood count, so we can identify the seriousness or severeness of the infection. So these are the main diagnostic management for laryngitis. Along with this one, laryngoscopy is there. That is a instrument which we are using for the procedure, where we are using the instrument laryngoscope to visualizing the larynx. Okay, doctor can visualize, examine vocal cords in a procedure called laryngoscopy by using a light and a tiny mirror to look into back of your throat. Okay, so with the help of the laryngoscope we can do this particular examination, so we can visualize the larynx and vocal cord. Doctor may use fiber-optic laryngoscopy. Sometimes fiber-optic laryngoscope is there. So in that fiber-optic laryngoscope, the tip of the laryngoscope, there is a camera is there. So it is very easy to identify the internal structures. This involves inserting a thin flexible tube or endoscope with a tiny camera and light through nose or mouth and into the back of throat. Then the doctor can watch the motion of vocal cord as the person speak. So with the help of fiber optic laryngoscope, they can easily examine the vocal cord, and they will, while doing the examination, they will ask the patient to talk something, so they can identify whether there is any thickening or any edema is there on the vocal cord, any obstruction is there. So it will helps to identify the laryngitis. Next one is biopsy. If the doctor sees a suspicious area, doctor will prescribe for a biopsy, taking a sample of tissue for examination under a microscope. So while doing the laryngoscopy examination, if the doctor found any suspicious sound, like a suspicious thing, like any new growth or any abscess formation, then doctor will take a sample from the larynx and send it for microscopic study for identifying any malignancy or any abnormal growth. Then next is the treatment or the management. In that, first we will see how we can manage the symptoms. Sometimes laryngitis may be more serious. Several symptoms should cause the symptoms to see a doctor. High fever with a sore throat, coughing up yellow or green phlegm, coughing up blood, unable to take liquids, history of breathing problems, symptoms that last for 2 to 3 weeks despite resting the voice. Child are different than adult because they are more likely to become infected with certain microbes. So these are the certain symptoms which make a patient to consult with a doctor for laryngitis. They should have a fever, high fever with a sore throat and high fever. Coughing will be there, and while coughing, they are getting a yellow or green phlegm. Green phlegm is occurring because of the presence of gastric content. Then coughing up blood, sometimes when if the mucous membrane is too much irritated, then blood also can occur. Then dysphagia or unable to take liquids. Then history of breathing problem, unable to take breathe properly. So these symptoms that last for 2 to 3 weeks despite resting the voice. So after arresting the voice also, if the symptom is not subsiding, then they have to consult with the doctor for proper management. If the child just has a hoarse voice with or without other symptoms of a virus such as low grade fever less than 100 degree Fahrenheit, runny nose, muscle ache, cough or nasal congestion, then the treatment is same as for an adult. So if a child, if the patient is a child and is having a hoarse voice, okay, hoarseness of sound is there with or without other symptoms. If sometimes other symptoms will be there, sometimes other symptoms will not be there. So if it is with or without, if they are having hoarseness of sound, then they have to go for the same treatment as adult. The child has a fever, a sore throat, won't eat or think, or has a decreased number of wet diapers, indicating less than adequate drinking, however, should take the child to see a doctor. So, in case of dysphagia or difficulty in swallowing, the child may not take a fluid or food properly, that can lead to dehydration. Okay, that's why they have mentioned here decreased number of wet diapers. So in children we are using diapers. So if the number of diapers which is changing is less, that means the child is not urinating properly. That is a sign of dehydration in the body. Then we have to immediately seek the medical help. Then supportive therapy or voice rest. Okay, that is a non-pharmacological management. Voice rest should be given. Then steam inhalation, proper steam inhalation help to reduce the swelling of the mucosa. Avoid smoking and cold. Avoid exposure to smoke and cold. Fluid intake, proper fluid intake should be done. Voice rehabilitation, humidification, increase intake of fluids, then reduction of high impact stress to the vocal cord caused by loud, frequent, and high pitched voices recommended. You have to advise the patient to avoid high pitched or frequent loud voice, okay, because it can irritate the larynx. So these are supportive or pharmacological, non-pharmacological management. Let us see the medical management. In that, first one is administration of antifungal or antibiotics for bacterial or fungal infection. Then short course of steroids like prednisolone or dexamethasone. It will helps to decrease the inflammation and shorten the course of symptoms. Then H2 blocker receptors that mainly we are using for gastroesophageal reflux disease. It will helps to reduce the gastric reflux. Then analgesics to control pain and cough suppressants. Okay, because patient having sometimes having continuous cough will be there. So in order to treat that one, we have to provide cough suppressants. Then the nursing management to prevent dryness or irritation to the vocal cord. We should prevent dryness and irritation Do not smoke and avoid passive smoking. Smoke dries throat and irritate vocal cord. Drink plenty of water. Fluid help keep the mucus in the throat thin and easy to clear. Advise patient to avoid cleaning the throat. This does more harm than good because it causes abnormal vibration of the vocal cord and can increase swelling and cause the throat to secrete more mucus and feel more irritated. If it is in a chronic condition or if more symptoms are there, we have to tell the patient to avoid gargling and all because it can lead to more irritation to the mucus. Then avoid upper respiratory infections to prevent upper respiratory infections. Wash hand more often and avoid contact with people who have upper respiratory infections. You have to always follow a proper hand washing techniques. The following steps may relieve the symptoms of laryngitis and reduce strain on voice. Use a humidifier. Another thing is humidifier we have to use keep the air throughout the moist home. Try a cool mist humidifier. Avoid air conditioning. Drink plenty of fluids to prevent dehydration because of dysphagia or difficulty in swallowing. There is a chance of less intake of fluid that can lead to dehydration. So we have to provide proper fluids. Avoid alcohol and caffeine. Give your voice a break. Rest the voice when and as much as possible. Inhale steam or breathe moist air. Breathe in steam from a bowl of hot water or a hot shower. So steam inhalation should be done. Voice rest should be given. Then avoid alcohol and caffeine. Plenty of water for treating dehydration. These are the nursing management for laryngitis. Then the what are the preventions? It including wash hands before touching face. It will helps to prevent the entry of organism into the mouth or into the respiratory system. Hemophilus influenza vaccine for children to prevent the possibility of life-threatening bacterial infection. Hib vaccine, okay, hemo influenza vaccine should be given to the children's. Prevention of overuse of voice, that is very important because that can lead to voice box inflammation or laryngitis. So this is all about the topic. So far, we discussed about what you mean by laryngitis, what are the causes. Then we have seen what are the types of laryngitis, acute and chronic. We have seen, and we have seen the causes for each one. Then pathophysiology, signs and symptoms. Then we have seen how to diagnosis. Then management in that medical management, non-pharmacological and non-pharmacological management. We have seen. Then we have seen the nursing management, and finally complication. I hope all of you understand about the topic. If you are having any doubt, you can feel free to contact me. Have a nice day. Thank